Hi, I'm Patricia Ali Aftelisirna, and for today, I have some questions for you. So first is, had you experienced upon waking up after feel mong yawning, you cannot close your mouth as if it just want to stay open? Or maybe in another situation that you're about to deliver that monster bite to that TV ad saying, isa pa ngang chicken drumstick, then you find your jaw not opening as if it is locked, or you're in a rush to finish that general anatomy laboratory drawing, or worse, come up with your oral anatomy wax carving that looks nothing like a tri-rooted maxillary first molar. Exasperated, you clench your teeth. A pain radiates from front of your ear to your temporal area. Hi, pain! Nakisabay ka ba? Or, how often had you overheard your lola saying, bakit ba pag ako ay nanganga, tumutunog yung aking panga? What is it? It's like an episode from Netflix, Stranger Things. According to a US study, 5 to 12% of their population is affected by it, 95% of whom are women. It affects more than those who have fibromyalgia and diabetes. While at times it gives pain in your head, eyes, ears, mouth, teeth, jaw, neck, shoulder, back, and you suffer from ache, pain, ringing, tiredness, and dizziness. So today, to fully understand this, our group will discuss about craniomandibular structures that plays a role in speech, breathing, and eating. So first is, what is temporomandibular joint? The temporomandibular joint, or known as the TMJ, is the joint that connects your mandible, or your lower jaw, to your skull. The joint can be found both on your sides of the head, in front of your ears. It allows your jaw to open and close, enabling you to speak and eat. The temporomandibular joint is a biarthroidal hinge joint that allows the complex movement necessary for life. It is the joint between condylar head of the mandible and the mandibular fossa of the temporal bone. This system is made up of TMJ, teeth, and soft tissue. So it is formed by the articulation of the mandible, the temporal bone of the cranium. It is located anteriorly to the tragus of the ear on the lateral aspect of the face. Do you know the unique feature of temporomandibular joint? The unique feature of temporomandibular joint is the articular disc. So what is articular disc? Articular disc is a flexible and elastic cartilage that serves as a cushion between the two bone surfaces. Okay, back to temporal mandibular joint. It is a bilateral synovial articulation between the temporal bone of the skull above and the mandible below. Since the TMJ is connected to the mandible, the right and left joints must function together and therefore are not independent of each other. So, from all the informations that I have shared with you, I am Patricia Ali de la Sirna, and lagi niyong tatandaan na ang temporomandibular joint or TMJ ay very helpful para sa atin, lalo na pagdating sa speech, sa eating, and sa breathing. Kasi siya yung joint na nagko-connect ng ating mandible or yung lower jaw sa ating skull that can be found on both sides of our head in front of our ears. And ang kanyang function ay para makapag-close and open ang ating lower jaw. Pero hindi dun tatapos lahat ng yon. Further knowledge will be discussed by my group mates. So stay tuned and keep on watching. Thank you!
Good day everyone, I'm Jezreel Andy Basa, and for today I will be discussing the articulations of the temporomandibular joint, or also known as the craniomandibular articulation. Have you ever wondered what mechanism allows you to open your mouth? For example, in chewing your favorite snack, or to answer back when your mother gives you a 30-minute sermon because you know you are right, but it's risky because with one, mas matanda ako sa'yo, mama mo ko, your mouth needs to be closed again. Or if you are that lucky kid to yawn while just waiting for the 30-minute sermon to pass by. So have you ever wondered that? If you did, then let me make things comprehensible for you all. And again, I'll be discussing the temporomandibular joint articulation, which helps upon opening and closing your mouth. The temporomandibular joint is an example of a gangliomo-arthrodile articulation, and its movements are a combination of gliding movement and hinge movement. This is located between the mandible and the temporal bone of the skull. The osseous part of the joint are the anterior portion of the mandibular glenoid fossa and articular eminence of the temporal bone, and the condylar process of the mandible. And the functional surfaces of both the condyle and eminence, along with the anterior aspects of the condyle, are the functional articular surfaces. And interposed between the condyle and temporal bone is the articular disc. And now let's move on to the most important part of this discussion, the articulations of the temporomandibular joint. First off, an articular disc divides the articulating surfaces into upper and lower compartments, and the lower compartment is bounded by condylar head of the mandible, which allows the mandible to rotate and lets the mouth to open and close. And the upper compartment is bounded superiorly by the two regions of the temporal bones, the mandibular fossa in the middle and back, and the articular tubercle in front. This compartment allows the condylar head to move forward and rotate. So the first articulation of the TMJ is the joint capsule. The TMJ is enclosed in a capsule that is attached at the borders of the articulating surfaces of the mandibular fossa and eminence of the temporal bone and to the neck of the mandible, which reduces the friction. Second is the mandibular glenoid fossa. It is an oval or oblong depression in the temporal bone, just anterior to the auditory canal. It is bounded anteriorly by the articular eminence, externally by the middle root of zygoma and auditory process, and posteriorly by the tympanic plate of the petrous portion of the mandible. Third is the condyloid process. The condyloid process of the mandible is convex on all bearing surfaces, flattened posteriorly, and its knob-like form is wider lateral-medially than antero-posteriorly. Its development differs in individuals, however, the functional structure remains the same, and the condyle is perpendicular to the ascending ramus of the mandible. And the last and most important articulation of the TMJ is the articular disc. The articular disc consists of fibrous tissue shaped to accommodate the shape of the condyle and the concavity of the mandibular fossa. The thicker anterior and posterior bands and a thin central zone are evident. The superior and inferior heads of the lateral pterygoid muscle both insert into the pterygoid fovea of the mandible, with part of the superior head inserting into the disc and capsule. And it does not appear to be active during mandibular opening movement. However, it stabilizes the relationship of the disc to the eminence. And again, this articular disc divides the upper and lower compartment of the TMJ as mentioned earlier. So, when the jaw opens and moves forward, the intermediate zone of the disc is interposed between the anterior slope of the articular eminence, the condyle, and the bilaminar region of the disc, fills in the mandibular fossa. And continued anterior displacement of the disc with the posterior band in an anterior-posterior with the jaw closed prevent the jaw from opening normally. An example of that is the locking of jaw. So now you know what mechanism allows you to open your mouth. And that's all for the articulations of the temporomandibular joint. Thank you.
Good morning guys, I'm Stephen Quintero and today I'm gonna be talking about the functions of each parts of the TMJ. So, ito yun, tignan nyo yung picture. So, meron kasi ang apat na parts na I will be talking about. The first part is yung mandibular fossa. Mandibular fossa is yung depression sa may temporal, located sa temporal bone natin. Dito banda guys. Dito pag ganito siya. Pag ganito yung shape niya guys. And ang function niya is to enable the interaction with the mandibular condyle. So yung mandibular condyle kasi guys, dito naman siya located sa lower jaw. And ang shape niya pag ganito. Pag ganyan guys. Ang function nitong mandibular condyle is siya yung nagpa-facilitate ng articulation. Kasi nga, di ba, lower jaw lang lagi yung gumagalaw. Never nagumalaw yung upper jaw kasi fixed na siya. So, dito naman sa ganyan, movement niya pag ganun. And dyan papasok ngayon yung third part, which is the articular disc. Dito siya, naka-insert. Yan. Para pag nag-move siya guys, pag ganun. Yung articular disc sa gitna, it serves as a cushion to lessen the stress. Para hindi masyadong magkis-kisan ganun. And yun. Tapos, ang last part is yung articular tubercle. Ang function ng articular tubercle is dyan naka-attach naman yung ating lateral ligament ng TMJ. So, yun lang guys. Thanks for listening.
Good day. My name is Micaela B. Shapna and I'll be discussing the concepts of occlusion. So basically, there are three concepts, and these are centric relation, centric occlusion, and maximum intercuspation. So number 1, centric relation. It is also known as the ligamentous position or terminal hinge position. Why? Because it is the starting point and ending point of the mandible movement. As you can see here in the picture, the relation of mandible to the maxilla when the mandibular condyles are in the most superior and retruded position in the glenoid fossa with the articular disc or TMJ disc that is properly interposed. Also, this kind of movement or position occurs while crushing food or taking in food. This position is independent of tooth contact and clinically discernible position when the mandible is directed superiorly and anteriorly. To understand why the concept of CR, or also known as centric relation, is so important, you should first consider the jaw itself. The jaw is unique in the human body for three reasons. First, it functions bilaterally. For example, you raise your one arm at a time and you can open one side of your jaw or mouth at the same time, right? Well, then maybe if you can, you'll get a perfect score in oral anatomy. The jaw can, however, it moves in different directions, unlike a knee or elbow that only rotate. The jaw not only rotates but also translates. This is what happens when you protrude or move your lower jaw from side to side, such as when you chew. Third, the jaw is the only joint in the body that has teeth attached to the other end of it. And how those teeth meet when you close your jaw can determine how the lower jaw relates to the skull. The concept of CR, or centric relation, describes the only repeatable position of the lower jaw in relation to the skull. Being repeatable means that the lower jaw can return to the same position relating to the upper jaw. This isn't something that the average person would normally feel or be aware of. You don't really think of this when you speak or chew. It just occurs naturally. So the next concept will be the centric occlusion, or also known as the intercuspal position or convenience occlusion. Alright, to simplify, it is the term that describes the position of the lower jaw when you bite and all your teeth come together. It's like this in the picture. So this may or may not coincide with the maximum intercuspation. For example, you may be able to bite with all your teeth coming together, but your lower jaw may not be seated ideally in the joint. To differentiate CR from the CO, always think that the CR is bone-to-bone relation while the CO is tip-to-tip relation. Alright, so for the last concept, it would be the maximum intercuspation, or also known as the habitual or acquired occlusion. It is the complete intercuspation of opposing teeth independent of condylar position. It means that both arches fully interpose themselves with the cusp of the teeth of the opposing arch. Actually, it is an important job position as it defines both the anterior-posterior and lateral relationships of the mandible and the maxilla, as well as the superior-inferior relationship known as the vertical dimension of occlusion. These are important considerations when evaluating a patient orthodontically as well as restoring them prosthodontically. In 10% of population, the MIC or the maximum intercuspation coincide with the CR or the centric relation. It's also been recorded that the maximum intercuspation in healthy dentition is usually 1 to 2 mm anterior to the C. And that ends my reporting. Thank you.
Hey guys, I'm Rachel D. Flores. You can call me Rachel, and in this video, I will be discussing and demonstrating the movements of the temporomandibular joint. Now, I know you already know this, but TMJ is actually two joints in one, and they act synchronously with each other. The first one is the upper joint. It is between the articular eminence and the articular disc, and the lower joint is between the condyle and the articular disc. Now, the movements at this joint are produced by the muscles of mastication and the hyoid muscles, and the two divisions of the temporomandibular joint, which are the upper and the lower, have different functions. Now, for the upper part of the joint, it allows for protrusion and retraction of the mandible. It is the anterior and the posterior movements of the jaw. For protrusion, the lateral pterygoid muscle is responsible for it, which is assisted by the medial pterygoid, and the posterior fibers of the temporalis perform retraction. Now, for the lateral movement, for example, chewing and grinding, it is achieved by alternately protruding and retracting the mandible on each side. Now, for the lower part, it permits elevation and depression of the mandible, which is the opening and the closing of the mouth. Depression is mostly caused by gravity. However, if there is resistance, the digastric, geniohyoid, and mylohyoid muscles assist. Now, you guys should remember that elevation is a very strong movement caused by the contraction of the temporalis, master, and the medial pterygoid muscle. So basically, guys, yun na yun. Pero para mas maalala nyo, let's do a recap. So let's get started. So, for protrusion, it is the anterior movement of the articular disc and the head of the mandible onto the articular eminence of the temporal bone. For retrusion, it is the return movement of the articular disc and the head of the mandible into the mandibular fossa, which occurs in the upper compartment of the joint. Depression and elevation involves the lowering and raising of the jaw, which occurs in the lower compartment of the joint between the articular disc and the head of the mandible. For the combination of the two movements for lateral deviation, these are both the alternating, the protrusion, and the retrusion of the right and the left temporomandibular joints. Now, for demonstrating the movements, let's call on Art Flores. Hey, thanks for having me. So I will be discussing, or rather demonstrating, the movements of the temporomandibular joint. So look at me, not her, okay? So for the protrusion, it's like this. For the retrusion, it's like this. Okay? For the depression, it's like this. For the elevation, it's like this. And for the lateral deviation, it's like this. So that's all, thank you. I'll be going now. Alright, so that's it. Thank you so much. Next up is my soy. High five, soy! Alright, so that's it. Thank you so much for our guest for today, Art Flores. So, yeah. Next up is my soy. High five, soy!
Nice one, Soy. Thank you for that informative presentation. That was astonishing. By the way, I am Jamaica Pineda-Nawi and you can call me Jem for short. So let's talk about what is TMJD or TMD. It is Temporomandibular Joint Disorder. This abbreviation has also been used to refer to a group of health problems related to your jaw. These disorders can cause tenderness of the joint, facial pain, and difficulty moving the joint. The TMJ can become unhinged from the skull. The unhinging of the jaw joint is known as dislocation that can create problems with eating, talking, and even in breathing. That is TMJ disorder. So let's go now to what causes TMJ disorder. In some cases, trauma to the jaw or joint may play a role. Pero sometimes, ang causes lang naman talaga is arthritis, erosion of the joint, habitual grinding or clenching of the teeth, jaw problems present at birth. And sometimes, yung mga factors naman is hindi pa proven, but ito sila. The use of orthodontic braces, poor posture that strains the muscles of the neck and face, prolonged stress, poor diet, and lack of sleep. So, matulog tayo ng maaga. Kahit hindi yan uso sa ating dent. Let's move on to the symptoms of TMJD. Simple lang naman, pain that can be felt in the face or neck, stiffness in the muscles of the jaw, limited movement of the jaw, locking of the jaw, clicking and popping sound from the TMJ side, and even the malocclusion. So sometimes, pwedeng dito lang yung masakit, and dito lang yung masakit, and pwede rin yung both. So, we talked about the causes and symptoms of TMJD. So now, I will share with you guys how you will treat TMJD. So, simple lang, kain ka lang ng soft food, and use ice to reduce swelling, reduce jaw movements, avoid chewing gum and tough food. And alam nyo ba guys, fun fact lang, isang cause din ng TMJD is yung pagtawa ng malakas. Yung super ganito na yung open ng mouth mo, kakatawa. Yung kitang-kita na yung uvula mo, kakatawa. Isang cause din yan na magdi-dislocate yung jaw mo. So guys, please, huwag niyo akong gayahin. Ganun ako tumawa. Anyway, so that's how we treat TMJD. Lastly, how can TMJD be prevented? So, totoo niyan, hindi naman natin kaya i-prevent eh. But we might be able to reduce symptoms by lowering our stress levels. Guys, may kilala ba kayo? Ganito kaingay yung mouth nila pag natutulog sila. Ganyan kaingay. And we can't blame them kasi hindi sila conscious. So, better to tell them na magsuot na lang sila ng mouth guard the whole night and continuous hanggang sa ma-prevent na nila yung TMJD. So, that's all. That is Temporomandibular Joint Disorder. Thank you so much.
Let me talk to you. Let me talk to you. Let it rain. Let me talk to you. Come on.
Shawty had a big appetite, bumili siya ng burger. Nung mga aray, ano yun, it really hurts. Pumunta kay Doc, next thing you know, shawty got lockjaw. Tapos nung okay na, nagutom siya ulit. Bumili pa siya ng chips pero inagaw lang. Napasigaw, pagsigaw niya, lock yung jaw. Oh, I never seen nothing that'll make me go this crazy TMJ disorder though. Hindi ko na alam anong gagawin ko. Favorite day cakes just sold the show. It's popping though, wasn't flexible, professional, like an X-ray. Hold up, wait a minute, do you see if my body's right? Did I think I was all good? Oh, ate the same, but when it's time to close, make it fine, I'm making it glow. I woke up and yun dahil sa call, I got a bill if kumagat oh no. Ang sakit adnak lang ang aking jaw. TMJ X-ray is dead me later. Crashing air problem kay it more success. My jaw them nakakain na siya ng maayos. Di na masakit ang kanyang jaw. Salamat Doc, Cause magaling na ang pangako ko. Ang tension ko sa joke, kaya ko nang humanga. Gumuya o humikab ay pwede na. No more kirot, no more lungkot. Ang sakit ay no.